Okay, welcome to the joints lecture. In this lecture, we're going to learn about how different bones articulate together to make certain joints. And really, we're going to talk about the classification of joints, meaning how they're functionally classified in terms of their movement and how they're structurally classified in terms of what composes that joint. So the functional classification is based on how much movement a joint has. As you know, your shoulder joint moves differently than your elbow joint. Elbow joint seems to only move in one axis, while the shoulder joint can move 360 degrees. So that's what we mean by the amount of movement. There are three classifications in terms of function. Synarthroses, which means an immovable joint, and that's going to be like the ones that you see in your skull, those sutures that are still considered joints, but they don't move about each other. Amphiarthroses, which is slightly movable. This is again in your axial skeleton. Remember, axial skeleton is your skull, your vertebrae, and the rib cage. The last one is diarthroses. This is going to be found mostly in the appendicular skeleton because the function of these guys is to really be freely movable. So you have a lot of movement in the diarthroses joints. The second way of classifying is structurally. So structurally, like, what are joints made out of? Well, if you were to think of what a joint is right now, you would probably say like bones with some sort of cartilage. That is true. There is more to it than just that. Some joints are classified as fibrous joints. They have a lot of fibrous material in between them. These guys are not generally very flexible or movable. There's cartilaginous joints, which, like the name states, is predominantly cartilage. And then there's our big joints called synovial joints. These are our large complex joints like our knees and our shoulders. So let's start by talking about fibrous joints. So if I go back one slide, we're going to go right now through these three structural classifications. I'm going to give you examples, and your job is to know the examples under which of these structural classifications they fall into, and specifically their structural composition. So the first one is a fibrous joint. They're connected by fibrous connective tissue, and they do not have a joint cavity, which means, let's say we're talking about the parietal bone in the skull and another parietal bone in the skull. They're connected together directly without any kind of spacing in between them. These kinds of joints are considered immovable and sometimes just slightly movable. Now, there are three types of fibrous joints specifically. These guys include sutures, syndesmoses, and gomphoses. Sutures are the ones that are found in the skull. Syndesmoses and gomphoses, I will give you two of the examples of these guys and their illustrations. The first one is the suture, like we talked about already. And the sutures are only going to be found in the skull. Remember, we have that suture there, this suture here. We've got another suture here. And the fourth one is one you can't really see. It goes across the top between the parietal bones. This is what they look like very up close. This middle stuff is not cartilage. It is dense, fibrous, connective tissue. So, sutures are a type of fibrous joint. And when these fibrous joints ossify kind of around your 30s, it is then called a synostosis. So, as you get older, these regions in between the bone turn from fibrous connective tissue into actual bone. So you have direct bone-on-bone connection. When that bone-on-bone connection happens, you call it a synostosis. You no longer call it a suture. The second type of fibrous joints are going to be bones that are connected together only by ligaments. Remember, ligaments are pieces of connective tissue that connect bone to bone. The amount of movement between these two bones and in this joint depends on how long the ligament is. Of course, the longer the ligament is, the more of movement you're going to have between the bones. There are two specific examples that I want to give you of syndesmoses. Number one, the tibiofibular joint. That is this picture right here. This is a very short ligament, and it creates an immovable joint. Remember, under the functional classifications, an immovable joint is called synarthroses. So do me a favor, and next to synarthroses, write immovable type of joint. A synarthroses is an immovable type of joint. That is the definition of this. And then I'm going to draw the next example here. That's your radius. Let's do the ulna. All right, so I've drawn as best as I can your radius and your ulna. These guys, if you recall from the bones lecture, they have this membrane in between them that connects them. That is called the interosseous membrane. Interosseous membrane. This membrane is flexible. It does allow the radius and the ulna to move. We call this diarthroses. Anytime you want to take your palms, face them up, face them down, do that rotation with your wrists, that is considered a rotation, and we classify that under diarthroses, a freely movable joint. And the last and third type of fibrous joint is called a GOMPHOSES. The only place this is found is in your teeth. If you notice, this is the border of the tooth right here, and the bone is here. If you guys notice these lines that connect them, that is called the periodontal ligament. It is a ligament, and it is what actually connects your tooth into the socket, and we call this type of joint a GOMPHOSES. Now let me ask you a question, and you can answer it to yourself. Do you think this joint should have any type of movement in it? No, it should not. Otherwise your teeth would be really loose, which means we call this a synarthroses. Remember, synarthroses means no movement. Excuse the writing, using my pad here. All right, so the next grouping of joints is called cartilaginous joints, and these cartilaginous joints are really mainly made up of cartilage. And that cartilage is going to be there to protect bone-on-bone contact and to provide spacing in between the bones. There are two main types of cartilaginous joints, synchondroses and symphysis. Again, make sure you know the names of these two and examples of them. So the first one is called a synchondroses. Synchondroses specifically have hyaline cartilage in between two bones. Two really good examples of this is going to be one, the epiphyseal plate, and that's going to be this region here that's found between the shaft and the tips of the bones. This epiphyseal plate is made out of cartilage for the majority of your youth. And once you go through puberty, this epiphyseal plate turns from cartilage to actual bone through a process called ossification. So this epiphyseal plate is called a synchondroses. It is simply bone, cartilage, bone, directly connected together. The second one is going to be specifically the joint between the rib and the manubrium. There is only one rib that connects to the manubrium, and it is rib number 1. It is connected using hyaline cartilage and is called a synchondroses. Now, what is the difference between this joint and all the rest of the ribs that connect? The rest of the ribs have a little bit of flexibility in their cartilage. This is why you can do CPR on someone and push their sternum down, and the ribs will just bend back and forth. They can crack, but they do have flexibility. The difference is between rib number 1 and the manubrium. It is immovable. You cannot have any flexibility between rib 1, the cartilage, and the manubrium. Same thing here. There's no flexibility, no movement between the tip of the bone and the shaft of the bone. Next to these synchondroses, please write synarthroses. The same word that I put here, put it here. It means immovable. The second type of cartilaginous joint is called a symphysis. Specifically made of fibrocartilage, symphysis is a type of joint that, again, brings two bones together, but its goal here is to resist tension and compression. We're going to see this kind of joint in the intervertebral discs, so this right here. These discs are made out of fibrocartilage. They do allow for slight movement. Otherwise, you wouldn't be able to move your vertebrae. The second kind is called the pubic symphysis. And the pubic symphysis, as you learned when we talked about the pelvic girdle, holds the pubic bones together. So one pubis to another pubis is held together by a piece of fibrocartilage called the pubic symphysis. And again, it is slightly movable. And the last and third classification of joints are synovial joints. We're going to spend the rest of the joint lecture on synovial joints in terms of structure, because these are the most complex and there's a lot of characteristics to them. Key thing here, these are the most movable, and therefore we call them diarthroses. Diarthroses have a large range of movement, and they're going to include joints like your shoulder, your hip, your knee, your elbow. All are considered synovial joints. Now, these 5 features are found in all synovial joints: articular cartilage, the joint cavity, the capsule, the synovial fluid, and the reinforcing ligaments. Now, what I'm going to kind of go through before I go through this slide is this image, because I think it's important for you guys to picture what the joint looks like before me going into the details of what each thing is. So, synovial joint, bone 1, bone 2. On top of each bone, you're going to have this blue piece of cartilage called articular cartilage. So that is articular cartilage and articular cartilage. Connecting the pieces of articular cartilage in green, you have what's called a synovial membrane. This membrane creates a little housing compartment inside, and you need that housing compartment because you need to have somewhere to hold the synovial fluid. And this fluid acts as a lubrication. It also provides nutrients to the joint itself. So again, you have the bones, you have the articular cartilage, you've got the joint cavity full of synovial fluid, and that housing compartment called the synovial membrane. Outside of the synovial membrane, you have a layer called the fibrous layer. That fibrous layer and the synovial membrane come together to make the articular capsule. So again, these are the main features that are found in all synovial joints. And you'll see that in every synovial joint example that I give you, I'm going to name these exact same features And I'm just going to point them out. They're going to be slightly different places. So let's go back to this. These are those 5 main features that I'm going to label in all different joints. Now, what is the function of these guys? Well, let's start with the articular cartilage. The cartilage is going to cover each side of the bone that you have, and the point of the cartilage is going to be to absorb compression, and really it's there to also prevent bone-on-bone grinding. And the type of cartilage it is made of is hyaline cartilage. The joint cavity, which is the open space in between the joint, is really what's unique to synovial joints. No other joints have a cavity. That's a space in between 2 bones. And this is the space that's required to hold synovial fluid. Think of this as having the consistency of egg whites. It literally looks like egg whites, and it has the same texture. So it acts as like kind of a watery, jello-ish, lubricating material. Articular capsule is going to be that capsule, the housing compartment that holds the fluid inside. And it's made out of 2 layers, as you saw. The outer layer, which is the fibrous layer, made out of dense, irregular connective tissue. And remember, any kind of fibrous tissue means it's really strong and rigid and tough. Underneath it is your more delicate layer called the synovial membrane. It is made out of loose connective tissue. And what's really important to remember about the synovial membrane is the fact that this is the membrane that actually makes synovial fluid. So this membrane is what creates the synovial fluid. But what is synovial fluid again? It is like egg whites. It comes from your blood. So the synovial membrane has blood vessels in it, and it comes from your blood through the synovial membrane, and it secretes into that joint cavity. It has glycoproteins. Glyco means sugar, and protein, of course, is just proteins. And this provides nutrients for the joint. And the last thing, in the outermost region, where the bone and bone need to bind together, you have reinforcing ligaments. So again with this picture, bone and bone, cartilage, cartilage, capsule, capsule, fluid, and ligament. I'm going to pause here for a moment. Are there any questions? You can unmute yourselves now and ask me any questions you need. Feel free to speak up out loud.
Can the membrane run out of fluid, or is it always regenerating the fluid?
So let's say there's a blood vessel going into the membrane. As long as there's blood flow into the membrane, you can always make fluid. But let's say like your blood flow stopped. That's when you would like slow down fluid production or stop making it. And then sometimes you can rip the membrane and fluid can start leaking out into your knee. And then that makes your knee look really swollen. And usually it's easy to detect because when you like press on it, it's like liquidy and feels like a water bed almost. And you can tell that there's fluid buildup inside. That's a good question.
Thank you.
Thank you. Any other questions, guys? Okay, so the first example that I want to give you is the TMJ, the temporomandibular joint. So let's write TMJ here because I don't see it written down anywhere on this slide. So this is the temporomandibular joint. So your temporal bone is here and your mandibular bone is here. And if you recall, this part is called the mandibular condyle. It is what actually binds into this ridge of the temporal bone. What I'm showing you here specifically on this slide, the takeaway from this slide is that sometimes the bone doesn't fit into the opening of another bone. So we need to provide some sort of adapter, and that's going to be this little disc right here. We call this an articular disc. You have them in your TMJ, and you also have them in the knee joint. But in the knee joint, you don't call them a disc, you call them a meniscus. If you've ever heard someone like ripping, tearing, slipping, or damaging a meniscus, that's really what they're talking about. The adapter in between the two bones. So this adapter allows for two bones with slightly different shapes to come together and articulate. All right, now we're getting into the movements of synovial joints. Once we get through this section of movements, it's going to end with structures of different synovial joints. Now, there are three basic types of movement for synovial joints: gliding, angular, and rotation. Gliding movement is when two approximately cube-shaped bones are gliding back and forth across each other. Angular movements is literally what the name says, changing the angle between bones. This would be your knee, and you can write that down, your knee and your elbow. The last one is called rotation. Rotation is moving around a bone's long axis, and that literally means like if you take your hand and you rotate it facing towards the sky and then facing down. And you can also rotate your hip bones as well. Now let's look at what a gliding joint is. Gliding joints are between the bones that are here. Do you remember the 8 that we listed? Those are called your carpals. Your carpals are somewhat cube-like bones, and when you take your wrist and you move it back and forth, you're gliding those bones against one another. This kind of movement is also going to be found in your tarsals, which, if this is your foot, your tarsal bones are right over here. Those are the ones of your ankle. Angular movements are going to be increasing or decreasing the angles between joints. We have terms here that I need you to know: flexion and extension. For flexion, write decreasing the angle of a joint. Decreasing the angle of a joint. For extension, write increasing the angle of the joint. And then we have a term called abduction and adduction. I have a really easy way for you guys to remember this. Let's say this is your arm here, and you're taking your arm from this position and adding it down onto your body. Bringing that arm down is called adduction because you're adding it to your body. If you move that arm up and out away from your body, we call that abduction. Because if you're moving it out and away, you're being abducted by aliens. So abduction is moving away and out. Adduction is adding towards and in. Last one is called circumduction. The prefix circum means circle. Circumduction is if you take your arm and you start moving it in a circle, round and round. You're experiencing this movement in this joint, but that movement itself is called circumduction. And these are all part of angular joints. The third type is called rotation. So you can rotate your thigh in and out. You can rotate your head left and right. All of those are considered rotation. You're turning a joint around its long axis. So you can also do it with your shoulders. You can rotate it out and you can rotate it back in. Those are the three main types of movements of synovial joints. Using the TMJ joint, which is right about here, there are two special directions of movement. Elevating the mandible and depressing it. This is something you guys do as you eat. And protracting the mandible, which is giving yourself an underbite, and retracting the mandible, giving yourself an overbite. And you also do this unconsciously when you're eating. So these are considered special movements. And again, that TMJ is a synovial joint. Other types of special movements is going to be supination and pronation. When your palms face up towards the sky, it is called supination. I want you to notice that the radius and the ulna are parallel to each other. Now let's say you take the palms and face them down toward the ground. I want you to notice that the radius rotated around the ulna, and now they're in a rotated and crisscross shape. If you remember, we talked about the interosseous membrane, and I said it is not immovable. It provides a little bit of movement. That's this movement right here, the ability of these bones to rotate about one another. The third kind of special movement here is called opposition. This is literally simply the ability of your fingers to one by one come and connect to your thumb, creating an O, which is a good way to remember that this is opposition. Then we have your foot. Bringing your sole of your foot towards your medial line is called inversion. Moving it out is called eversion. Pointing your toes towards the sky is called dorsiflexion. And an easy way to remember this is when you're trying to hold the door open for somebody. I don't think you open the door and hold it open like this with your toes pointed. You flex your foot up and you hold the door open like that. Pointing the toes down is plantar flexion. You're pointing your toes down and it's pushing you up like a plant. So anytime you stand on your tippy toes by pointing your toes down and pushing your heels up, it helps you move up in height like a plant. Those are the ways that I remember them. You can come up with any way that you'd like to remember them. Classifying them by shape. We briefly talked about the carpals and how the carpals were somewhat cube-shaped. And being cube-shaped, they are able to slide and glide past one another. These are called plane joints. Plane joints don't bend or move in any axis. They don't rotate. They simply slide across one another. And the two places you're going to find them are in the intertarsals and the intercarpal joints. So these are called plane joints, and they are a type of synovial joint. The second type of synovial joint is a hinge joint. Hinge joints are going to be in the elbow, ankle, and joints between the phalanges, so your fingers. Hinge joints move in a single angle in a single plane. So we call them uniaxial. If you notice here, you have the ulna with the trochlear notch around the trochlea, and they slide back and forth. So mechanically, it looks like a hinge. The third one is a pivot joint. This is movement in a single axis as well, but by rotation, hence the name pivot joint. The proximal radial ulnar joint, and proximal means this region closer to the elbow. If you see, it's a circular ligament, and it allows for rotation, and that rotation is going to be in a turning motion. So if you put your arm out in front of you and you take your palms and you face them down, palms face them up, and you keep your elbow as stable as possible, that movement is a rotation. The same thing with the atlas and the axis. That means the C1 and C2 vertebrae. You turning your head left and right, saying no, is a type of pivoting. Condylar joints, these are called biaxial joints because they can move in two different axes. And these guys are going to be found between the metacarpals and the phalanges. So these are where your knuckles would be found. If you take your finger, you can move it front and back and left and right. That is considered a biaxial joint. And then we've got saddle joints. Saddle joints are only going to be found in the thumb. So these guys are also considered biaxial because if you take your thumb, you can move it front and back and left and right. The last and largest type of joint is called a ball and socket joint. These guys are multi-axial. The two places these are found are the shoulder and the hip. Ball and socket joints are basically 360 degrees of movement, and they are made up of the head of a bone, so the head of the humerus or the head of the femur, and the socket that they go into. So for the shoulder, it's the glenoid cavity, and for the femoral head, it's going to be the acetabulum of the pelvis. So here's the TMJ. This joint has a few of the main features that we've seen before: articular capsule, articular disc. We've got a joint cavity. And remember, the joint cavities are full of synovial fluid. And then the one thing that's not labeled on here is these blue pieces. This is called the synovial, or you can call it articular cartilage. So this here and this here, write down articular cartilage. So if you notice, the items that we had labeled in the initial synovial joint picture, they're going to come up just the same, but in slightly different locations, as you can see, just based off of the structure of the joint. So this is considered a hinge joint, and it articulates the temporal bone with the mandible. Now this looks a lot more complicated. It's all the same except for one difference, and I'll tell you that difference in a second. We have the humerus. We have the scapula here. The scapula, remember there's the glenoid cavity, which is the opening, and the acromion, which is the top of the scapula. In blue, articular cartilage there and there. In green, here, and circling around, you've got the capsule, which is made up of a synovial membrane and the fibrous capsule. There's your articular cartilage. And then in the middle, in yellow, is the synovial cavity full of synovial fluid. The additional piece that's on this joint that you haven't seen yet is what's called a bursa. A bursa is synovial membrane full of synovial fluid, and it's almost like a pocket of fluid that sits between two bones to help prevent them from grinding on each other. The acromion and the the acromion and the head of the humerus aren't the main interacting bones. It's the head of the humerus with the scapula that are the main interacting bones. But nonetheless, they are two bones in close vicinity. So we add a bursa in between to provide padding in between those two bones. So with that being said, you're going to see a bursa again in the knee joint and in the hip joint. So again, this is your shoulder joint, also called the glenohumeral joint. Your wrist joint, if you remember, I said the radius is what actually creates the wrist joint. The ulna doesn't actually have anything to do with your wrist. The ulna has to do with your elbow. So what is the radiocarpal joint? Well, it's the radius interacting with the carpals. That is your radial carpal joint. And then the intercarpal joints are the joints between the distal and proximal row of carpals. So this is the proximal row of carpals. This is the distal row of carpals. In between them is a joint as well. The next one is the hip joint. Let's go through this again. Femur, pelvis here. In blue, you have your articular cartilage. In green, you have that synovial capsule. We'll call it the articular capsule. Inside is the synovial cavity full of synovial fluid. And you have ligaments here connecting bone to bone, bone to bone, and bone to bone. So it just looks like something more complicated, but it still has the same features as a typical synovial joint. This is considered a ball and socket joint. So this is your ball, and the acetabulum is your socket, and it is a freely movable joint. You can move it in all directions. And the last one, the knee joint. This is the most complex joint in your whole body, which is why it gets damaged so often. You need to be very careful with your knees and make sure you don't damage them, because oftentimes when you damage a joint, it's very difficult to get it to being back to what it was before it was damaged. So let's look at what we have here. We have the femur, we have the tibia. You've got in blue the articular cartilage and articular cartilage. You have the ACL, which is called the anterior cruciate ligament, and behind it is the PCL, which is the posterior cruciate ligament. Easiest way to remember those names is think of them as being named based on where they bind on the tibia. So this is the tibia. The ACL is more anterior. The PCL is more posterior on the tibia. Then you see the meniscus here. This showing you the lateral meniscus. There's also a medial meniscus. This meniscus is like that disc that we saw in the TMJ. It helps to accommodate two bones to fit better onto each other. And then, like I promised, we've got a bursa here and a bursa here. This bursa and this bursa, the purpose of them is to help the patella slide back and forth. When this patella slides back and forth, it has to have some sort of cushioning in between them, or else it'll start grinding on the femur or grinding on the tibia. So that's the purpose of these bursa. If we look deeper in, you'll see the purposes of the ACL and the PCL. When you flex your knee, and flexing is decreasing this angle over here, the ACL pulls the tibia back. If you tear your ACL, your tibia ends up pushing forward here, and you'll see kind of a bulge coming out from below where your knee should be. The PCL pulls the femur back, so when you bend your knee, this femur stays nice and taut back here. If the PCL is torn, this femur ends up coming and pushing out that way. So tearing an ACL or a PCL is a huge, huge deal in terms of your ability to move the joint and where the bones are actually positioned. When you're standing up straight, the ACL and the PCL should be nice and tight. There's no bending, no movement, and they are considered taut, T-A-U-T. What you don't see on these pictures is the LCL and the MCL, but I'm going to show you those on a separate image in just a moment. So that's it for the joints lecture. I'm going to pause here.